Hi guys, it's your next door nurse Florence and you're welcome back to my channel where we talk all about emergency health and wellness tips. In today's video, we're going to be talking about lung cancer. We're going to be talking about causes, the signs and symptoms. We'll talk about the staging, the diagnosis, the risk factors. We're going to also define it, then we'll talk about the prevention and its management. Stick with me. The lungs are two spongy organs in your chest that takes in oxygen when you inhale and releases carbon dioxide when you exhale. Obviously, lung cancer is a type of cancer that begins in the lungs. It is the leading cause of cancer deaths worldwide. Smoking causes the majority of lung cancer, both in people that smoke and those who are exposed to secondhand smoke or passive smoke. Secondhand smoke or passive smoke is a combination of smoke from the burning end of a cigarette and the smoke exhaled or breathed out by the smokers. It is believed that smoking causes lung cancer by damaging the cells that lines the lungs. When an individual inhales cigarette smoke, which is full of cancer-causing substances such as carcinogens, changes in the lung tissue begins almost immediately. At first, the body may be able to repair this damage, but with each repeated exposure, normal cells that lines the lungs are increasingly damaged. Over time, the damage causes cells to act abnormally and eventually cancer may develop. Lung cancer also occurs in people who never smoked and in people who never had prolonged secondhand smoke. In these cases, there may be no clear cause of lung cancer. The risk factors for lung cancer includes 1. Smoking. Your risk for lung cancer increases with the number of cigarettes you smoke each day and the number of years you have smoked. 2. Exposure to secondhand or passive smoke. Even if you don't smoke, your risk increases if you are exposed to environmental tobacco smoke as a non-smoker. 3. Previous radiation therapy. If you have undergone radiation therapy to the chest for another type of cancer, you may have an increased risk of developing lung cancer. 4. Family history of lung cancer. People with a parent, sibling or child with lung cancer have an increased risk of the disease. 5. Exposure to radon gas. Radon is produced by the natural breakdown of uranium in soil, rock and water that eventually becomes part of the air we breathe. Unsafe levels of radon can accumulate in any building or homes, increasing the risk of lung cancer. 6. Exposure to asbestos or other carcinogens. Workplace exposure to substances known to cause cancer such as arsenic, chromium and nickel can increase your risk, especially if you're a smoker. 7. Vitamin supplements. It was once thought that a vitamin supplement like beta-carotene could reduce the risk of lung cancer in heavy smokers. But there is substantial evidence now that taking beta-carotene increases lung cancer risk, especially in smokers who smoke one or more packs of cigarettes a day, and higher in smokers who have at least one alcoholic drink each day. The two general types of lung cancer include the small cell lung cancer and the non-small cell lung cancer. Small cell lung cancer occur almost exclusively in heavy smokers and it is less common, while non-small cell lung cancer is an umbrella term for several types of lung cancer. Non-small cell lung cancer includes squamous cell carcinoma, adenocarcinoma, and large cell carcinoma. The signs and symptoms of lung cancer occurs when the disease is advanced. It typically does not cause signs and symptoms in its earlier stages. Common lung cancer signs and symptoms include 1. A new or chronic cough that does not go away, lasting at least 8 weeks. 2. Shortness of breath. 3. Wheezing. 4. Hoarseness. 5. Coughing up blood or bloody mucus, even if it's a small amount. 6. Chest pain that gets worse with cough or laugh. 7. Fatigue. 8. Losing weight without trying. 9. Repeated respiratory infections. 10. Headache. 11. Bone pain. 12. Muscle weakness and or eyelid drooping. Once lung cancer has spread beyond the lungs, it is generally not curable. Treatments are available to decrease the signs and symptoms and to help you live longer. So you need to seek medical help immediately if you notice any of these signs and symptoms. Tests to diagnose lung cancer may include imaging tests such as X-ray, computed tomography scan of the lungs, and magnetic resonance imaging. Other tests that could be performed are bronchoscopy, sputum cytology, endobronchial ultrasound, medial stenoscopy, video-assisted bronchoscopy, wedge resection, and biopsy. Biopsy is the most common tool to obtain tissue for diagnosing lung cancer. Staging allows your physician to fully understand the extent of your lung cancer, to determine treatment decisions or options, and to predict expected outcomes. The straightforward way of describing staging might be as follows. 1. Localized. The cancer is confined to the lungs. 2. Regional. The cancer has spread to the lymph nodes or glands within the chest. 3. Distant. The cancer has spread or metastasized to other parts of the body. There is no sure way to prevent lung cancer, but you can reduce your risk if you 1. Quit smoking. Talk to your healthcare provider about strategies and stop smoking aids that can help you quit. 2. Don't smoke. If you have never smoked, don't start. 3. Avoid breathing in smoke from people who do smoke. 4. Avoid secondhand smoke. If you live or work with a smoker, urge them to quit or they should smoke outside. Avoid areas where people smoke, like bars and restaurants. 5. Test your home for radon gas, especially if you live in areas where radon is a known problem. You can contact your local Department of Public Health for help. 6. Avoid carcinogens at work. Take precautions to protect yourself from exposure to toxic chemicals at work. For instance, if you are given a face mask for protection, always wear it. 7. Choose a healthy diet with a variety of fruits and vegetables. Avoid taking large doses of vitamins in pill form, as they may be harmful. 8. Reduce your exposure to chemicals that are known to cause cancer, like air pollution from diesel engine exhaust, asbestos, radon, etc. 9. Exercise most days of the week or perform regular exercises. Lung cancer is a challenging cancer to treat. The most critical factors in determining the survival rate of lung cancer is the cell type and stage at the time of diagnosis. Those that are diagnosed at the localized stage may be curable. It is important to discuss the goals of treatment with your physician. Some treatments may be used to control the cancer, others are used to improve quality of life and or reduce symptoms. Some of these treatment options include surgery, where a lobectomy or a pneumonectomy is performed. Radiosurgery. This procedure aims many beams of radiation from many angles at the cancer. This procedure may be an option for people with small lung cancer who cannot undergo surgery, or for cancers that have spread to other parts of the body, including the brain. Other treatment options are targeted drug therapy, chemotherapy, radiation therapy, immunotherapy, and palliative care. So guys, we've come to the end of this video. If you find it helpful and useful, give me a thumbs up by clicking on the like button. It does a lot of good for me. Subscribe to my channel please, and click on that bell icon so you'll be the first to know when I upload new videos. You can drop your comments or questions or concerns in the comment section below. I will love to know what you think about this video. I'm still your next door nurse, and I'm just a local. I love you guys. See you